Hey guys, what's up? Welcome to another episode of the Coach Cody podcast. So today I'm just going to dive right in. Not going to be talking about any studies, not going to be talking about the weather. Well, maybe a little bit because I do want to talk about seasonal depression. That is the main topic. So there's a little weather thrown in there by default. But mainly I just want to always emphasize mental health because there's still so much of a stigma around it. I feel like we've gotten better about talking about it, or just normalizing going to therapy and that sort of thing. But I feel like talking about it is one thing, but when someone kind of witnesses your struggles or is affected by your struggles, whether it's, even if it's not necessarily negatively affected, that's when people are like, no, you keep that to yourself. I don't want to see it. You can talk about it, but I don't want to see it. So just to give you a little personal story experience, I do want you to know that I struggle with both depression, anxiety, and now, my latest OCD. So I just got a diagnosis of OCD, I think about a couple months ago now, couple months. Still trying to wrap my own brain around it because I just thought I had really bad anxiety for as long as I can remember. And all I knew to do about my anxiety was try to hide it as much as I could. And apparently I was so good at that I didn't get a diagnosis of OCD until now as an adult in my 30s, which is kind of sad because I feel like if I would have felt okay expressing my anxiety and how intense it is, how severe it has been for me, if I felt safe doing so earlier, then I probably would have gotten a diagnosis sooner and wouldn't have felt like I needed to hide it as much. And I've always talked about how social anxiety has been the biggest thorn in my side, how it's, ruins opportunities, relationships. It has impacted my life severely. And I've lived a very small life because of it. And, I'm just now working through all that and then also realizing that it's not just anxiety, it is actually OCD. So I'm going to therapy for that now, ERP therapy, which is exposure response prevention therapy. That's supposed to kind of disrupt the cycle of OCD. You have obsessions, you have compulsions, and basically sometimes you just get stuck in those obsessions and compulsions and it's pure hell. So I just wanted to talk about that a little bit because I feel like one of the things that we do still as a society is we treat mental health issues like they're a choice still. When someone says they're depressed, just be happy. Happiness is a choice. Or if someone says they have anxiety, don't stress. You stress too much. Just calm down. Don't worry about it. Yeah, it's that simple. Or if you have OCD, it's just don't do whatever compulsion, as if it is something all of these things we would have done by now if it was a choice. And I feel like that's the next step pertaining to mental health, is actually seeing it as just as bad as any sort of physical ailment or treating it as such. It's like someone who has a broken leg, you can very easily tell, oh, you broke your leg. I'm so sorry. That must have been so painful. You make accommodations. Maybe they need, they need help, right? We are so much more willing to help people who are showing physical signs of distress because they broke a leg, or maybe they have cancer, or whatever. There's a lot of empathy and sympathy for people who have physical issues going on. But when it comes to mental health, it's just so what? And you're just expected to function in society just like everyone else without any help. And if you need help, then you're just a burden. So for mental health issues to still be seen as such a burden, it makes me really sad, and it's why I hid things for so long. And it's still something that I'm trying to work through of not being ashamed about. And I think mostly I wanted to share this just to say, if you struggle, I feel ya. It can get lonely, it can get tough. You can look back on your life and be like, damn, like what would life have been like if I didn't struggle with this? Or what would life be like if other people took me seriously and didn't just tell me to get over it or brush it off? And I think the support there is still severely lacking. And so I just want anyone to know that if you struggle with, any sort of mental health issue, you're not alone. It's real. It's valid. And hopefully you have a support system or people in your life who acknowledge the reality of that and who support you through it and help you when you need help, and not just tell you to brush it off and get over it, because it's just not that simple, right? So anyways, enough about my personal story. I can talk about that more if any of you would like. I think the biggest thing or why I would want to talk about OCD is because sometimes you don't know what's normal. I did not know I had OCD. I thought it was just extreme anxiety, and I couldn't understand why I couldn't get over it or why it just never left. And now I know why, and I'm getting the help I need. And the sooner that you can acknowledge these things, sometimes the sooner you can get help. So I just want to encourage anyone, don't hesitate to get help, because you can improve your life much more. You can improve it quicker. You don't have to live your life so small. So reach out, whether it's a therapist, psychiatrist, a friend. Talk to someone, and hopefully there's more people out there that you can trust. I will say I kind of regret masking my anxiety for so long, but I just felt so crazy. I didn't want anyone to see it. It's a very vulnerable thing, but sometimes, certain life circumstances, you get to a point where you can't hold your crazy in anymore, and you don't want to get to that point. It's like, I feel like I got a diagnosis because I hit a breaking point, but you don't have to hit that breaking point. So, get help before you reach that point, and it's going to go a little smoother. But yeah, I don't know where else I'm going with that, except for if you have extreme anxiety and you've not known any different, you might consider looking into OCD. I feel like we don't talk about it enough because we all picture OCD. This is why I didn't think I had it. We all see OCD portrayed in this way of hand washing and being afraid of germs and stuff like that, but it's actually so much more than that. I could do a whole episode on it, but I'm not quite an expert on it. I just have it, so I won't do that quite yet. But I just want everyone to know OCD is not just about germs, hand washing, and that sort of thing. There's so many different aspects to it. So if you think you might have OCD because you have really, really bad anxiety, something to look into, and I will kind of give you a little link. There's this, I'm doing therapy through a website called NoCD, so nocd.com. Check it out, learn a bit more about OCD, even if you don't have it. Maybe you know someone who does, and it's very helpful, to gain knowledge about, even if it's a family member that has OCD. So yeah, enough about that. We won't talk about my OCD for this whole episode, but I might at some other point. But I will say it's a game changer to finally know what is going on and having a diagnosis and being able to work towards getting better and being on a path and feeling like there's at least a little bit of hope, and not as much feeling like this is forever and it's just gonna ruin my life, sort of thing. So anyways, let's talk about seasonal depression. Yeah, all right. So just to give you a definition of what seasonal depression or seasonal affective disorder is, so it's a type of depression that's related to changes in seasons, obviously. So most people, the symptoms start in the fall and continue through the winter months, and symptoms can include feeling depressed. No shit, right? So most of the day, every day, losing interest in activities you once enjoyed, just overall having a hard time feeling joy in general. I feel like it's a good way to kind of express depression. But so causes, It's not completely understood, the causes, but I think the pretty obvious cause would be that we have shorter days. It's darker out. We're not getting as much sunshine. And that can in turn deplete vitamin D, which does have an impact on your mental health, but also basically a reduction in sunlight, can cause a drop in serotonin, which is a brain chemical that helps regulate your mood. So keep things in check there. Make sure you're not noticing any mood drops. If you are, let's talk about what to do with that. But first, let's go over who's at risk. And actually, women are more at risk for seasonal affective disorder. I feel like it's because just more, aware. It's like women are just more aware of surroundings and feelings, I feel like. And when things get dark outside, gosh, my computer just went black and that distracted me. And now I'm losing my train of thought. We can also talk about ADHD as a diagnosis. Hey, I have anxiety, ADHD, OCD, and depression. We're going to get through this segment here. So anyways, so women are at higher risk for seasonal depression. And also, if you live far from the equator and you have, daily hours are very short, that's also going to put you more at risk. Or if you have a family history of depression. So about 5% of adults in the U.S. experience SAD. It typically lasts about 40% of the year, and usually starts in about young adulthood. So if you start getting SAD around, fall as the days get shorter, there's a reason. Could be seasonal affective disorder. So how do we possibly combat it? There is some things that we can put in place to try to mitigate it, or at least, handle it, deal with it a little bit easier. Not to say it's going to be completely a cure, but one thing we can try here, light therapy. I have personally never tried this, but maybe I will this year. So there's these little lights that you can buy. It's called a light therapy box. And so the box emits light that mimics natural outdoor light and appears to, cause change in brain chemicals and mood. You can buy these off of Amazon. You might get an ad for it now that I'm talking about it, and your phone's like, yeah, we're listening. Here's an ad on Instagram. And also, here's an ad for everything else that your phone has been listening to. So you might be conned into purchasing this light box now that I have talked about it. But at the same time, it might not be the worst thing, because apparently there are studies that show that it can be helpful. As far as what can also be helpful is exercise and outdoor activities. If you can exercise outdoor, cool. 2 birds, 1 stone. The more sunlight you get in the winter months, the better. So even though the days are shorter, if you still get a good amount of time outdoors in the sunlight, it's going to be helpful. So try to make a point to do that, getting out for walks, setting step goals to encourage you to get out for a walk throughout the day, multiple times a day, even if they're short 10-minute breaks, right? Obviously, nutrition is also going to play a role, making sure you're getting nutrient-dense foods, balanced meals to support what your body needs. Vitamin D is going to be, a big one here, and we get that from the sunlight. So we do tend to have lower levels of vitamin D in the winter, which does contribute. Vitamin D does play a role in mood, so you might need to supplement with that in the winter, or even if you have a desk job, for example. You're indoors a lot, so even in the summer, you might still need a supplement because you're just not outside enough. I personally, I do technically have a desk job. I'm a coach, but a lot of my work is online. I'm answering emails. I'm creating programs for clients. So I'm indoors a lot. And the most sunshine I get is probably taking my dogs out to go to the bathroom or riding my boosted board to the gym. But outside of that, I just don't get enough sunlight. So I do supplement. My latest blood work, I was on the lower side. So you can OD on vitamin D. You got to be careful because this is a fat soluble vitamin. So we just don't clear it out. We don't clear the excess out as easy as water soluble vitamins, because you normally just pee those out. If you've ever had like an energy drink or you take a multivitamin and your pee is like bright yellow, those are just B vitamins that you're pissing out. So we can't do that with vitamin D. So you do have to be careful. It can be toxic in high doses. So getting your blood work done, testing vitamin D is the best way to figure out if you need to supplement. If you don't have the money to supplement, if you don't have the money for blood tests, or your doctor won't order them, just take into consideration how much time you're spending outdoors. And the majority of us are low in vitamin D. So it's a pretty common thing. If you supplement, just don't go over the recommended amount that the supplement is telling you. So be safe, get your blood work done, but if you can't, just be careful about how much you're supplementing with. All right, so some other things to help combat it. Obviously, things like going to therapy, cognitive behavioral therapy, just having someone that you feel like is supporting you, that you can talk to if you're feeling down. That obviously goes a long way, especially if you don't have a support system or friends. Then at least you have therapists that you can talk to and kind of help support you through the seasons of depression. There are, alternative therapies too. If it's not, even if it is seasonal depression or just depression in general, we have other things now. Obviously medications are an option. I personally don't do well with SSRIs, so I like to just worst case, I try to stay away from them, which is why I did something called TMS this year. And I'm not an expert in TMS. I was purely just a patient. But it's transcranial magnetic stimulation, I believe is what it stands for. And they put these magnetic coil on your head, and it feels like it's zapping you. Essentially, it wakes up the part of your brain that regulates mood, and it just stimulates it. So that's how it kind of helps with depression outside of just using medication. So if you're someone who has resistant or depression that is resistant to medication, then you might try something like TMS. There's also ketamine, esketamine, and esketamine is cool now because it is now covered by insurance. I have not tried that, but I have tried ketamine in lozenge form. So I will say that both ketamine and TMS have been helpful for me. The lozenge one I tried, but it was a home thing. So I didn't feel completely safe and relaxed trying it, because you're dosing yourself, and it's different every time depending, because it's a lozenge. So it's whatever your body absorbs through your mouth. So sometimes it was stronger, sometimes it was weaker. And so I might give esketamine a try at some point, and I will let you know how that goes, especially since insurance does cover it. And ketamine, you can also do IV ketamine. I don't think insurance covers that one though, and it's way more expensive and a little bit more intense, I would imagine. So if you're looking for, therapies outside of just medication, look into TMS, look into esketamine treatments. They're on the rise in popularity, and they don't have all of the side effects that, typical SSRI medications do have. Definitely the ones that I try to avoid at all costs, just because I don't do well with them. They work great for some people, but not so much for me. So don't shy away from alternative therapies. They're coming up with more, good options outside of medication. And of course, trying to, things that you can control on a day-to-day basis, stress reduction, obviously. So just making sure, you've got, maybe you're trying meditation, aromatherapy, whatever you can do to keep your stress levels in check is going to also be helpful. Obviously, exercise is something that helps with that. And also, other ways to kind of keep you moving is keeping a structured routine. Try to wake up and go to bed at the same time each day. Don't change too much from, the seasons changing. Try to just keep things the same. Try to make it so, you're getting out the door, you're getting in activity, even if you don't feel like it. There's going to be a lot of times where you don't feel like it. That's just what depression does. It sucks the joy out of everything. But unfortunately, it's only going to get worse, and it's going to just take over even more if you listen to it. Depression tells you not to do things you want to do or that you love. And so if you listen to it, then it's going to just keep pushing you down. So try to move as much as you can, even if you have to take small steps. It's going to definitely be better than nothing. And let's see. What other things can we do? Oh yeah, friends, family, support. I think, the holidays obviously can be another contributor to depression or stress in the winter months, especially if you're not close to your family or you don't have a family to spend time with. So, having a chosen family or a friend support, again, like I said, like a therapist support, maybe a support group, it's going to help push you through so you feel supported and you're not feeling alone throughout the holidays and that sort of thing. So basically, best way to get through seasonal depression is to keep doing what you're doing before the seasons changed. I'm not saying like ignore that the seasons change and pretend it's not happening, but actually kind of. So even if the days are shorter, it shouldn't change anything about your actions. You're going to have less time to get things done if they're outdoor activities like steps and whatnot. But so you might have to plan ahead just to make sure you are squishing all the daytime things into a smaller window. But try to keep things routine and structured as much as you can, and try to still get out and do the things you need to do, even if you're not so much feeling it. And that's not saying like, oh, you're depressed, do it anyway. That's not the sentiment I'm trying to get across. It's just like every little thing counts. So even if it's just a 5 minutes outside, 5-minute walk, a lot of times we just need to take that first step to get started, and we can progressively, keep pushing through. So anyways, and that's on top of, therapy, medications, whatever it is that you might need to help treat your depression. So that's about it. I know that season changes can be hard on a lot of folks, and it's when our health and fitness goals tend to fall by the wayside and we crave comfort foods. We're fighting off these awesome baked goods that come with the season, pumpkin spice, everything. But try to keep tabs on your nutrition and your fitness still as much as you can. Remember that you have to keep your best interests in mind. You have to parent yourself. So although there's going to be temptations, although there's going to be times where you don't want to get out of bed because it's cold and it's dark, just think about your future self. What are you going to need long term? And what do you need in this moment? And if you were your parent, what would you tell yourself? You'd be like, hey, like, I love you. I understand this is hard, but you really need to get up because I care about you. And if you don't, then it's going to be bad for your health. It's going to be bad for your mental health. So just try to give yourself what you need in those moments to be healthy long term. And I know, again, that is not easy, but just try to picture it of, be kind to yourself. Don't look at it. Don't beat yourself up. Ask yourself, what do you need in this moment? Like, how would you support a friend in that moment? And try to apply that to yourself. All right. So I'm going to wrap this up. Thanks so much for listening. And once again, if you are someone who struggles with any sort of mental health issues, just know you're not alone. I see you. It's valid, and it's not a choice. So don't let anyone go thinking or making you think it is a choice. It's a choice whether you work on it or not, but it's not a choice whether you're like dealing with it or not, if that makes sense. All right. That's it, guys. Peace out. I'll talk to you next time.